ShapingNJ is the state partnership for nutrition, physical activity, and obesity prevention. So what is our vision? ShapingNJ's goal is to create a New Jersey where regular physical activity, good nutrition, and healthy weight are a part of everyone's life. Through a shared vision by many, we can accomplish this in NJ. This is the first generation of children that are expected to live shorter lives than their parents. Obesity is truly becoming a national security issue. Making the healthy choice the easy choice is an uphill battle. In addition to more traditional educational approaches, ShapingNJ emphasizes policy and environmental change to support increased access and availability to healthy foods and to make physical activity choices easier for NJ residents. We can lower the effort it takes for each of us to eat healthy and be physically active by improving the environmental conditions in which people live. Why? The old approach did not work quickly enough. We are 30 years into this obesity epidemic and have not seen significant results. Obesity rates are increasing, as well as associated costs. While obesity has increased among all groups, its growth has been highest among children and minority groups, particularly Hispanic and African American children. There is also a relationship between income and weight, with poor children being much more at risk to being overweight and obese compared to children from families with higher incomes. ShapingNJ promotes healthy, active communities through policy and environmental change. We need to reach those people most at risk, that is low-income, minority, and disparate populations, often in inner cities. ShapingNJ has built a robust and multi-sectoral public and private partnership of more than 220 organizations, including businesses, state departments and offices, hospitals, nonprofits, universities, national associations, philanthropies, and many more. So here is the ShapingNJ program. First, ShapingNJ had to find partners to work with. Remember, this is a big job that we couldn't do alone, so we found many other organizations whose work is somehow related to obesity to join the partnership. Second, ShapingNJ's focus is on policy and environmental change. This is important. So, what does that mean? It's different than what we used to do, which is tell people to eat more healthy foods and get more exercise. That by itself has not worked, and people just continue to grow more obese. So now, ShapingNJ is looking at changing the environment to make the healthy choice the easy choice. Here's a picture of the kinds of traditional efforts that we have done in the past, such as health fairs and one-on-one education. And that alone, we know, aren't particularly effective. It's not because there's no value in doing them, but because it is not enough to address the complexities of obesity. Now we are focusing on changing the environment to support healthy behavior. We know that the causes of obesity occur at a social, economic, environmental, and individual level. Our societies become characterized by environments that promote physical inactivity and increased consumption of less healthy foods. Policy and environmental approaches that make healthy choices available, affordable, and easy can be used to extend the reach of strategies designed to raise awareness and support people who want to make healthy lifestyle changes. Here is an example of bike lanes which promote physical activity. ShapingNJ focuses on change in 5 settings: schools, child care centers, communities, healthcare facilities, and work sites. ShapingNJ aims to increase community capacity to produce and distribute healthy foods and beverages, including more farmers markets, farm stands, community-supported agriculture, urban farms, mobile markets, school and community gardens, and food pantries. It is also important to increase access and availability for routine physical activity by possibly building new streets and sidewalks to make it easier to walk or bike. Another solution could be to build and maintain housing, schools, libraries, parks, playgrounds, and other public facilities within easy walking or biking distance of each other. In particular, work sites should adopt the World Health Organization and UNICEF's 10 steps for successful breastfeeding. Another initiative is revising licensing requirements for childcare and after-school programs to ensure the consumption of healthy foods, encourage physical activity, and limit television viewing. Schools could also increase meal reimbursement rates so that they can purchase more fruits, vegetables, and other nutrient-rich foods and beverages. Physical education is a curriculum-based program that teaches skills for maintaining an active lifestyle, as well as providing time for physical activity. Additional opportunities for physical activity include recess, classroom-based movement, activity breaks, before and after school programs, and safe routes to school programs. At the worksite, it is important to promote health screenings, increase options for healthy food, physical activity, and weight loss counseling in the workplace, and highlight improvements in employee health and financial benefits for employers. Here's what you can do. You can find all of these on ShapingNJ.gov. ShapingNJ has a sampling of evidence-based toolkits that can help you do your work. And while you're there, see the social change video. This 3-minute video will give you an idea about the movement. Thank you.